Even if you decide to stay on the antidepressant forever, it's okay depending on what your doctor feels what is right to you. But you still need to know that there are so many other things that you need to do so that you can be stronger, be healthier, and then not as dependent on these. My stance on medication is that I'm not against it, but we do need to know why we use it, how we use it, when we use it, and when to stop using it. Because again, I am amazed how advanced the pharmaceutical technology has been and the medical industry has advanced. However, it creates a problem that we don't really listen to our body. And unfortunately, there are a lot of side effects from the antidepressant. I'm not opposing taking it, but again, we need to know why are we taking it. So first of all, a lot of people that takes antidepressant is because of seasonal affective disorder, depression, anxiety, insomnia. I understand that these health issues that definitely needs to be addressed. I'm not against taking it, but what is our exit plan? That's usually the problem. In my clinical practice, a lot of time I can see patients being on antidepressant for years, and there really isn't a way out. A lot of time, what we need to think about is that how do we promote health? Because antidepressant is more of a masking the problem. Yes, it does make you feel better. However, when we are taking it for too long, and then not really assess that if we can take the patient off, I don't think it's the best way. One of the issue with the antidepressant that I encounter all the time is that we do see some gut function being disrupted. And most of antidepressant, they are anticholinergic agent. And these agents actually can really disrupt the gut microbiome and the gut function. So a lot of time, if we abruptly take patient off the antidepressant, sometimes we can see disrupted bowel pattern. We can see a lot of gut issue. The gut function is what Chinese medicine and the functional medicine really trying to focus on protecting the most. We do need to know that, okay, if we need to take antidepressant, what else do we need to do to promote our health? Because when it starts to create dependence, then we actually have a bigger problem to solve. So when you do have to take antidepressant, and I feel that if this is something that you do need to take, you should take it. Follow your doctor's order and take it. However, you do need to know you have the autonomy of your body and you are the owner of your body. So you are responsible in helping your body and yourself to get stronger and healthier. Maybe we should look at the gut microbiome and the gut function. Maybe we need to look at the stress management and lifestyle change that also can help the antidepressant to work better, and then so that you don't need to be on it as long. So in Chinese medicine, when we take antidepressant, a lot of time it's like it still doesn't really help our gut function. As we know it, that serotonin and dopamine, most of them, 90% of the neurotransmitter are made and produced in the gut. So if we don't promote the gut function, then I don't think there is a really ultimate way to help with the emotional or affective disorder. Number one advice I'm gonna give to someone that's been taking antidepressant is that there is a way to promote your health that may or may not need the antidepressant forever. Even if you decide to stay on the antidepressant forever, it's okay depending on what your doctor feels what is right to you. But you still need to know that there are so many other things that you need to do so that you can be stronger, be healthier, and then not as dependent on these. When the patient needs it, I would usually suggest that maybe we can talk to the doctor, work with the doctor, and help to either reduce or protect the gut function as the primary method to help promote the health. If the patient really doesn't want to continue taking it, again, we need to work with the doctor in order to cut you down. But the golden rule of weaning patient off antidepressant has to be slow. And also, again, we need to fortify the gut function. We need to calm the nerve system. And we also need to promote a healthy hormonal production. If you like this video, please subscribe and follow me, and I'll see you soon.